Hi, I'm Dr. Hagmeyer with the Naperville Institute for NeuroMetabolic Solutions, and there's a hot debate going on right now that I see a lot of people who are suffering with Hashimoto's and low thyroid symptoms really just getting sucked into. And this debate really has many patients asking me about the type of thyroid replacement. Which is better, synthetic or natural? And the answer is really there is no better one. It really depends on what works for the individual. In reality, the answer to that question, what hormone should I be on if I have Hashimoto's, is really only 10% of that battle, okay? The other 90% of the battle is really what needs to be done to calm down that autoimmune attack. The second question that really needs to be done is are there other parts of the body that are basically being attacked by the immune system as well? Unfortunately, there's a lot of doctors out there who really don't understand Hashimoto's. They don't understand autoimmune conditions. They don't understand the things that triggers them. They don't understand all of the lifestyle factors, the day-to-day factors that really perpetuate this autoimmune attack. They never spend time becoming educated about what needs to be done or what can be done from a holistic perspective. You see, instead, we get stuck into these useless debates about Synthroid versus Armour, Levoxyl versus Thyroid. And none of this really matters. One of the reasons why I wanted to shoot this video was because just last night, I had a woman who came to our office and she had a TSH level that was well over 10. And she was never diagnosed with Hashimoto's prior to coming to my office. And so we were sitting down, we were going through the additional lab work that we had ordered for her. And surely enough, the blood work as it came back proved my suspicion correctly. It confirmed that what I had already suspected. And in fact, she did have Hashimoto's. In fact, her immune system was so active at this point in time that her antibody levels were over 1,000. And that's a pretty aggressive attack. But the funny thing is that the main reason she came to my office is that she knows that I work with patients naturally. And a friend of hers referred her to our office. And she said to me, you know what, Dr. Hagmeyer, I just don't want to be on medication. You know, I just don't want to be on synthetic medications. I want to do something natural. And so I said, listen, Joan, I said, you're beating yourself up for really absolutely no reason. You know, if your leg was amputated, if you wanted to ever walk again, you'd get a prosthetic, right? And that's how simple it would be. Your two choices would be, okay, I'm going to not get a prosthetic, I'm going to crawl for the rest of my life or use crutches, or I'm going to get a prosthetic. Well, you know, hobbling around or crawling on the floor is really the same analogy that I would use to someone who has Hashimoto's. It's really the same situation. In Hashimoto's, your thyroid is being destroyed by your immune system. And you're going to lose functionality of that thyroid gland each and every day that you're never going to get back if you don't address the immune system. Okay, so with the destruction of the thyroid gland comes a loss of those hormones. And if you've had Hashimoto's for some time, you probably lost quite a bit of this thyroid hormone, T3 and T4, that you're really never going to get back. And these thyroid hormones, in some cases, will need to be taken in the form of replacement hormone. Don't beat yourself up over this, okay? But at the same time, here's what you need to address. You need to address the immune system. Now, if you have Hashimoto's, there's a really, really good chance that you're going to be on some type of thyroid hormone replacement at some point in your life, okay? But what kind of thyroid hormone replacement is going to vary from person to person. And let me just take a few moments here and explain why. Some people do great on synthetic thyroid hormones. However, if you go onto the internet and you find yourself in a chat room or a forum, thyroid forum, you're going to see that people say that Synthroid is awful. Then you're going to see people who say that Armour is awful. You're going to find people that say that Levoxyl or levothyroxine is awful. And the fact of the matter is it could be awful for that person who made the post. But synthetic thyroid hormones do a great thing for some people. And for some people, bioidentical hormones can do a really great thing. But let me explain to you why. When you have Hashimoto's, you have an autoimmune attack on your thyroid gland. Okay? What's happening again is you start destroying the thyroid gland from that attack of the immune system. Okay? You start destroying the enzyme, specifically something called thyroid peroxidase. And you may also destroy something called thyroglobulin. Now, when you have autoimmunity and you're already targeted and it's attacking one tissue, Pandora's box has really been opened. The whole body is now really on the menu, unfortunately. The autoimmune attack can now progress beyond TPO and beyond thyroglobulin, and the immune system's attack can now be attacking the hormones themselves. It can attack T3, it can attack T4, it can attack the pancreas, it can attack the intestines, it can attack the brain. It can attack the red blood cells. There's a lot of different things that that immune system can attack. In your case, if you have Hashimoto's, it's attacking your thyroid gland right now. Now, if you're that person whose immune system is now attacking your own T3 and your own T4, and you start taking Armour or you start taking Thyroid, and you have a really bad reaction to it, there's a really good chance that that's what's happening. It's just like putting more wood on the burning fire. You were already attacking the thyroid hormone, and now you just gave the immune system a whole bunch more to really fuel that attack and keep that attack going. And I hope that makes sense. That person usually does great on synthetic thyroid hormones, but some people, again, don't do well on synthetics, and here's why. Synthroid, for example, contains fillers, and these fillers can stimulate your immune system to be more out of balance, and you can have a reaction to them. You can feel inflamed, or you may have more thyroid symptoms. You might be more fatigued. You might have more difficulty sleeping. You might be just totally zapped in terms of your energy levels. But the basic two scenarios that can happen is that you can attack your own hormones, or you can be stimulating the immune system by the type of thyroid hormone that you're taking and the fillers that are found in that particular medication. The fact is this, is if you're watching this video, you're going to have to find a doctor who will work with you, and you're going to have to find one that one of those thyroid hormones that's going to work best for you. So again, don't get sucked into this debate about natural versus synthetic. This is such a waste of your time. What you do need to focus on is, what am I going to do to stop this autoimmune attack and get this thing under control? Because the thyroid gland and thyroid hormone replacement is going to do nothing to address the autoimmune process. I mean, you could be taking Synthroid, you could be taking Thyroid. That is not going to affect your hormones, okay? And your autoimmune system could keep progressing and move on to other tissues like we talked about earlier. This is the dangerous aspect. Don't fall into that false belief that taking thyroid hormone is going to stop the immune system's attack. The only thing that it's doing is making up for those lost hormones that you're losing. Okay, here's another thing that you need to realize. Talked about this just a few minutes ago, but the immune system can attack your cerebellum, cause things like balance issues and coordination issues, movement issues. It can attack your pancreas and lead to diabetes. It can really attack any tissue and cause more symptoms that in the long run are going to be way worse than the way you're feeling right now, okay? And that's bad enough, okay? You've got to find a doctor who understands the synthetic or bioidentical hormone is just a really small part of the equation, okay? You've got to find the one that works for you. This doctor that you work with should also understand that you could react badly to either kind, and if you do, that can't be ignored, okay? More important for your long-term health, you've got to find a doctor who understands how to get this Hashimoto's autoimmune tissue attack under control. That doctor needs to help or understand how to balance out your immune system. I'm Dr. Hagmeyer. I hope this quick video really helps save you time in those areas of debates, and that time that could be better spent working with a doctor who can really help get your immune system under control. Take care.